Good afternoon, everybody. This is our mic check. If you can see us, if you can hear us, go ahead and give us a thumbs up so we'll know that our audio is working. And we will begin promptly at 3 o'clock.
Good afternoon. Beautiful day out there. I'm Ted Rumley. I'm a county chairman of the county commission. Been a lot of changes since yesterday. A lot of the governor gave his report yesterday, and there's a lot of interesting things that he said, and we're going to try to touch on some of those today. I'll go real quickly over the cleanup effort that we're doing here in the county. It's going real smooth. We are still asking people to go ahead and push things up to the side of our county roads. We'll be picking those up. The state will be leaving us probably tomorrow, pulling their trucks out, and they've done a great job. We appreciate all that they've done. But we're not going to leave you hanging on this. If it takes weeks or months to do it, we'll get everything cleaned up. It's not like it was during a tornado. I've had some people ask me about that. We're not getting the FEMA assistance that we did back then because of the size of the event. And I'm not saying we're not going to be declared, but still, though, we had a tremendous more damage then, and we had the trucks come in, the contractors. Well, we're having to take care of this ourselves, so it's going to take us a little bit longer, but we'll handle it. As I said, the governor at 4 o'clock yesterday, he did come to us with his order to, I guess it's called the executive order, as far as his reopening of Georgia. He based a lot of this on the this packet right here that's opening up America again. He refers to the different phases that the president has mentioned in it. And I'll go over some of the things that he actually said, some of the dates real quick. Some of you may not have heard exactly the places that he is actually turning loose to open back up. But I will go over our numbers today. And he's actually asking some of the places or telling them that they can open up gymnasiums and different things like that, and that's good, but it don't necessarily mean that we all can agree to this. I mean, that's his opinion, and that's great. But I'm going to go over these numbers here that we've got now, and our numbers in Dade County have changed quite a bit. We went from 8 yesterday, and now we're at 12. So that's a pretty big jump. Walker County now went from 15 yesterday at noon, and they're at 28. And that is touching us. That's part of that's right, that's our neighbor right there. Catoosa went from 21 to 26. Chattooga went from 9 to 10, which is not bad at all. 44 to 46 in Whitfield. Floyd 123 to 127. Gordon County, they're at 66. Bartow County went up 6. They're at 256. They were at 250. There's still 470 counties that are unknown. So that number changes. It varies, but and who's to say that? I'm sure some of these that we picked up yesterday, it just seemed like overnight that they came out of that right there. We cannot get that information from public health or any of the state officials. We've not gotten any official reports that we can give you except what you see here that comes at 12 o'clock at 12 o'clock, and also at what does it say? They update at 7. Is that right? 7 o'clock in the evening, 12 o'clock during the day. So it's twice in 24 hours, and that's open to everyone. So we're telling you everything we know that we possibly, and I say we, I'm talking about Alex, he's City of Trenton, myself, the county. So moving down to Tennessee. 118 in Hamilton County. That's up from 116. The good thing about Tennessee is they are getting the recovery reports, which is something we have not got. We can't get it from our public health for whatever reason. I don't know. Maybe they don't have that, but it does. It kind of makes you look. The numbers totally different because Hamilton County had 118 as of today. 66 of those people are recovered and back in society, back working. They had 12 that actually are deceased. Marion County, 28 today. They have 21 out of that 28 that's recovered and went back, and either went back to work or went back to their everyday life. One of those is deceased. Grundy County, they stayed the same today. They're 25. Out of 25, 20 of those people recovered. Sequatchie, they stayed the same. They have 3. 2 of those are recovered. Meigs, the same. They have 3. 2 of those are recovered. Bradley County, they have 37. They stayed the same from yesterday. Out of that 37, 33 of those people have recovered. They have a total of 152 deaths in Tennessee. Alabama, they're adjoining counties of Jackson County. We have 40 in Jackson County. That's up from 38 yesterday. DeKalb County has 47. That's up from 43. And they're not posting their recovered rates either. So that's Tennessee right now is the only state that we have that touches us anyway, that has given us recovery rates. So comparatively, in our county and in the other counties here in Georgia, if we had those rates, if you compare that as far as recovery, we're not sure how many of those 12 that they may have recovered weeks ago, or 2 or 3 days or whatever. So we may not have, we may have very few here actually that are still in the county that are active or confirmed. Of course, one of those was a deceased person. So, we Governor Kemp. I'm just going to go over this real quickly. Now, Alex is going to touch on it also, but he's saying that April the 24th, he's advising all gyms, fitness centers, bowling alleys, body art studios, hair designers, massage therapists. They may begin in person with minimum basic operations as defined by the executive order. And also he refers back to this when they do go back, this phase 1 of this opening of America. And that's really important because he's not giving them the okay to actually go back full force with their business, wide open. There's a lot of things that they have got to live by to do this. This is something you really got to think about, whether you're the shop owners or people that are going to be patronizing these places, because we're sure not out of this. And you can look at these numbers right now. So, we're just asking you to really use common sense, whether you're a shop owner or whatever, and really think about, this, and be really careful and follow these guidelines, because from what I understand from the governor and his office, these are going to be strictly enforced, because he's right on the borderline, I think, of actually opening these things or opening anything right now this quick. And he does this, but he's still keeping the shelter-in-place order in place, intact. So, it's kind of hard to understand. You're supposed to shelter in place, but he's giving you the right to go to these places and back, from what I understand. There's a lot of unanswered questions, and Alex and I, we've been on the phone all day off and on trying to get answers to different questions, and mostly it's from businesses to say, what can I do and what can't I do? Had a couple calls from some hairstylists here in the county, and from what I understand, today, I think it was around 1 o'clock maybe, their state board was meeting just for this, and so by this time tomorrow, they should be receiving, standards that they've got to live by when they go back to work. On April 24th, April 27th, subject to social distancing and sanitation mandates, theaters, private social clubs, restaurant dine-in services will be allowed to open. And he's also got bars, nightclubs. It says operator of amusement rides and live performance venues will remain closed. So that means the bars, nightclubs, operator like one of Soka, and places, performance venues, any concerts, they will remain closed. But then he still says that the shelter-in-place order is still active and will still expire on April the 30th at 11:59 midnight. But back up to the social distancing. In theaters and social clubs and in restaurants. Restaurants is really what's going to affect us here. Yes, you'll be able to go back in and eat at your restaurants, but it's going to be a whole different world when you go in there. And that's something the restaurant owners, I'm sure that in fact, I've had some of those people call about that, and it's spelled out. A lot of it right here. He's relating back to the federal opening America again. So just because he's actually opened this back up, we still have got an April 30th deadline on our shelter in place. We're going to maintain that here, and as far as accessing this building, at least till then, because we feel we're protecting our people and protecting you, because it is here in Dade County, people, I'm telling you. And it's not to shut you out or anything. Things are going pretty smooth outside, but we've got to prepare in here too. We've got some things that we've got to put in place that will protect our people from people coming in, as far as shields and different things that we're going to do. And you'll see that in a lot of places, not just in government buildings. You're going to see a lot of things that you're not used to seeing when you go into public places. Let me see here. I know Alex has got a lot to talk about too. I don't want to be too long here, but let's see. I've told you about our shelter in place. We're going to April the 30th. And the biggest thing, is just use common sense. That's all I'm asking. Even just because the governor, or because I tell you, the things you're trying to do, you think about it. You think about, your health, and you know how you feel, and you know how old you are. Because this is real, and you need to think about it before you either go in. And if you can stay at home, stay at home. If you can still buy groceries online or however you've been doing, that's fine. If you go out, wear a mask. That's not to say everything is just fine. It's going to be a long time before we ever get back to normal. And this is just the beginning. I'll go ahead and turn it over to Alex. I'm easy to find. Call me on my phone if you've got any questions. It's all I can tell you is be safe and just use common sense. Alex, you want to come on that?
Good afternoon. I'm Alex Case, Director of Dade County Emergency Services and Mayor of the City of Trenton. We'll go over the Phase 1 guidelines here shortly. I think Carey's going to bring that up for us. Again, Executive Rumley's talking about, and I've been sitting here reading a lot of your comments as we're on live, and you still have the right to stay at home. We cannot enforce any other orders or ordinances or proclamations or anything or resolutions to enforce this, as the governor stated yesterday. But again, the stay-at-home order is intact till April the 30th. And also the public health is encouraging our elder or any medical folks that feel they're sick from COPD, asthma, anybody that's got a vulnerable system to stay in place till May the 13th. The big thing on the reopenings, the houses of worship has been a big thing. There is some very strict guidelines on that. How to social distance. There's going to be a lot of creative ways probably brought up. How to keep the 6 foot distance. I know folks have talked about different times, and we're still waiting for those other guidelines as well. We feel ACCG and GMA will be issuing those statements to us to help answer your questions, because we've got the exact same ones you're throwing up to us as well. We're reading in the executive order, trying to see exactly what it means. Commissioner Rumley, our Executive Rumley, mentioned also these institutes that's being reopened this Friday. There's 20 steps in that executive order that you have to follow to redo that. They're very stringent. Public health and officials will be watching these, and you have to make that decision if you feel you can do that. If somebody calls us or calls public health or related in, we will investigate and make sure that you're all following those cases as possible. Again, the stay-at-home order was to slow the curve, and what we've reported, the curve is still climbing for us, as stated that we're all seeing. The questions you're saying and remarking, yes, the numbers have gone from 8 to 10 to 12 in the last 12 hours. We gained 2 more, or actually last most 12 hours we've gained 2 more. And seeing what happens tonight at 7, we'll see again. So again, we're early in this week. The executive order come out yesterday. We are here Tuesday, watching numbers what come out. That's one of the main things we will be doing. Again, please remember the stay at home is till the 30th, and your medical, if your immune system is down or any type of treatments in elders, you got till the 13th. Also, based on yesterday from FEMA and the private sectors combined to coordinate delivery of current shipments, there's a lot of nearly 57 million N95 masks, 77 million of surgical masks, 6.2 million of face shields, 11 million of surgical gowns, 587 million gloves, 2.1 million thermostats, and almost 11,000 ventilators that's being pushed out through all the areas throughout the states. Again, we were going to encourage the hotline. As Governor Kemp mentioned yesterday, Augusta Health University Healthcare System has got a hotline, and this is on our Facebook and website, 706-721-1852. And there's also a download app on your smartphones. It's AU Health Express, iPhone and Android. I did download that today and looked at it and just signed up, went through, and they've got a lot of physicians sitting there online to chat with you immediately with some symptoms, either online or face-to-face through their app. The current testing sites in the Northwest Georgia, Walker County is our closest site. If you have the symptoms of fever, dry cough, shortness of breath, you can receive a free test by the Public Health. At the Walker County Public Health Office, you can dial 706-802-5329. That's from 8:30 a.m. to 7 p.m. Monday through Friday, and from 8:30 and noon on Saturday. So again, we got a lot of the same feelings, and in these services that will be coming back available, I really ask you to look at the executive order. It's on our website. Encourage to look at the CDC website. Those 20 steps are there for these ones that was mentioned that will be able to open this Friday. You need to start prepping yourselves for that, and it's going to be just as much the responsibility of these businesses to encourage public social distancing and encourage yourself for personal protection with cloth mask, gloves, everything you can to make sure. And again, we're still at our stay at home till the 30th, and our elders to the 13th. Carey, I think, is going to go over some of the Phase 1 information, and it talks about everybody from individuals up to the businesses.
Many of you have asked what the Phase 1 guidelines are as put out by the White House, and that is what Governor Kemp said we are following. So here they are. So we're going to go over them for individuals, for employers, and for specific types of employers. If you want to just look at this, it is on our website. I have shared the link in the comments below, or the comments to the side, so you can see them there. So if you don't catch them, that's okay. You can also go to whitehouse.gov/opening America to see these guidelines for Phase 1. So for individuals, they're asked that vulnerable individuals should continue to shelter in place, and when in public, all individuals should maximize physical distance from others. Social settings of more than 10 people should be avoided unless maintaining 6 feet between people, and they're asking everyone to minimize non-essential travel. As County Executive Rumley said before, we still are under a shelter-in-place order until April the 30th. For employers, continue to encourage telework for your employees, and if possible, return to work in phases. Close common areas where personnel are likely to congregate and interact, or enforce strict social distancing protocols. Minimize non-essential travel, and strongly consider special accommodations for personnel who are members of a vulnerable population or who live with someone who is part of that vulnerable population. For specific types of employers like schools and organized youth activities that are currently closed, under Phase 1 guidelines, you should remain closed. Visits to senior living facilities and hospitals should also be prohibited, and large venues like sit-down dining, movie theaters, sporting venues can operate beginning Monday, the 27th, under strict distancing protocols. So the physical distancing protocols, maintaining 6 feet from other people, that starts Monday, the 27th. Elective surgeries can resume, and gyms can reopen if they adhere to strict physical distancing and sanitation protocols. So Commissioner Rumley and EMA Director Case have gone over this before. If you don't feel safe going out, don't go out. It is your right to stay at home if you feel like that's what you need to do. Also, if you do need to go back to work, check out those Phase 1 guidelines so that you'll know what your employer is supposed to be doing for you and what you're supposed to be doing for yourself. Part of what we're supposed to be doing individually is doing everything we can to make sure that we don't catch this virus. So I think with that said, that is all of Phase 1. Phase 2 and Phase 3 are also there. So I think we're going back to Commissioner Rumley.
Yeah. Come on up, Chad. We're not going to forget you. Almost. I had to look right at you. We have Chad here with the Sheriff's Department, then I'll wrap everything up.
I'm pretty unforgettable, Ted.
You hard to say that.
That's right. I hide well. Hello, everyone. I'm Chad Payne. I'm with the Dade County Sheriff's Office. I'm the Public Information Officer for Sheriff Cross. Sheriff Cross, he couldn't make it today. He's, as you probably have seen, he's been out in the community a whole lot since we had the tornadoes, and he's been helping with some cleanup. And actually, within the last couple of days, he had lunch with several troops from the National Guard that were here cleaning up nursing homes and serving the community. I just want to stress that we are still here, that we are still serving, that if you have any questions, you can contact us through our email, and that's info@dadesheriff.com. It's on our website. Also, it is on our Facebook page, as well as you can contact us at the Sheriff's Office at 706-657-3233. That's 706-657-DADE. You can call us there if you have any questions. A lot of what we're doing now can be done over the phone. Now, it won't always be that way, but as of right now, due to the precautions and things, that's the way we're handling it. We're also still doing the grocery pickup. I noticed in the last week or so that that seems to have dropped off a lot. We hadn't had many calls on that, but we are still offering that if you need it. Just one more thing I wanted to mention was that you've heard Commissioner Rumley and Mayor Case talk several times about the bump that we may see. Testing is becoming more readily available, so we want you to be vigilant when you see that these numbers are taking a mild bounce, but we don't want you to panic by any means. I know that several of our staff members in our jail have been tested. They got the antibody test to see if they had it, and if they do show up having it, then they have the test, but we did not have any come back showing that they were positive. And also, like this morning, I had my test in Lafayette. I did the antibody test myself to see if I had it, myself and my wife, who's a nurse. And while I was over there, there were lots and lots of people being tested in Lafayette. They've opened it up from just first responders to the general public now. So the reason you may be seeing this bounce is because they've approved more tests and the tests are out in the communities. Also, I saw where the FDA had just approved an at-home test for the coronavirus. So you're going to be seeing more numbers come at you, and those numbers are likely to be higher because we're finding out that more people have this because of that readily available testing. So like I said, be vigilant. Do everything that they've recommended here today, but also don't panic just because you see a bump in the numbers. And again, if you need us, you call us. I've given the numbers. Carey will post these numbers too on our thing, but we're here for you if you need us. And as always, if you have an emergency, call 911. Thank y'all.
Thank you, Chad. Good report, and I agree 100% with him. Don't panic. That's not what we're here to. We're just here to share information. We try to tell you the truth just as it is, and it's just something we're going to get over here before too long, and we just need to bear with it. I've had some questions too, and I don't know whether you answer this or not, Carey, but the answer to this, if you want to go a little deeper, is in this opening up of America again. He mentions as far as our church groups and all, and as far as from what I read in Governor Kemp's orders here, you can, as long as you social distance, and I'm not sure on the 10, the 10 only or 10 and under as far as church groups go. I don't know whether that, if you've got a church that's got 500, 600 people there going, or whether you've got 200 people. You might want to space and have maybe several services, maybe 2 to 3 services, and at least spread your congregation out in the room and do the 6-foot social distancing. But from what I understand, after Friday, he's fine with that. The governor is. So there again, your ministers, your preachers, and all, and your congregation use common sense, because this is real, and you're grown-ups, and also the grown-ups are, you're the eyes, and you're the responsible for your younger people. So, use common sense and use good judgment. Robert, you got anything you want to say? Robert Goff just walked in. He looks kind of like he's got his T-shirt on. He don't want to get up here, but I appreciate everyone working with us on this, on the cleanup, and also this here is big news. I mean, it's going into the phasing of trying to get back to normal. Even though our numbers keep escalating here, these numbers here, as I said yesterday and 2 days, 3 days ago, these numbers could be people that are not even walking here in the county. They could be out, in other parts of the country, but their address comes back to Dade County, and then we may have several here. But all I'm saying is, there's still a lot of unknown out there, and we could have some of our numbers in the unknown counties. So just don't panic and don't get all excited about it. This is something that, as I said a minute ago, we're going to get through with this. We'll be back here tomorrow at 3 o'clock, and we'll, if you've got any questions. Okay.
We do have some questions.
Okay.
The first one is, who will enforce this?
From what we understand from the governor's order, and it hadn't changed, it will be the health department, our public health department, which is downstairs, and he gave them full enforcement. I'm sure that of course, if you see anything, that's another thing. Don't be afraid. If it starts Monday and we go out and we start mixing and mingling, if you see people violating these orders and not doing the social distancing or whatever, don't feel like you feel bad about calling and reporting. You call us, or call the health department and report them. Well, they can go investigate, because you could be keeping a tremendous amount of people from transmitting this, into the public. So, but that's as it is, as it stands right now, unless the governor changes this. That's who he put in charge of enforcement.
Okay. And the next question is, will we get a testing facility in Dade County?
We're working on it. We're working on that. We are trying to as the best we can. We're low populated. We're 16,000, a little over 16,000. And the reason that they brought that in, that is supposed to cover Dade, Walker, and Catoosa, and Chattooga. And that's their closest. And because Chattooga could go to Rome, but that's supposed to be our regional testing facility, keep us from driving to Rome, Georgia.
And our last question doesn't have anything to do with COVID-19. It has to do with Sulphur Springs Gap Road. Mm-hmm. Do you know when that will be fixed?
Another month. It'll be down at least another month or so. Yeah. It's got major problems, and with the traffic flow that goes up and down that, we've got other roads at least we've got to fix that's in bad shape, and so it will be. It'll probably be the end of. Let's see, this is April. It'll probably be the end of May, middle of May before we ever get that open back up. Yeah. We were down there this morning actually and spent probably a couple of hours just getting our numbers together and exactly what's going on with it. Yeah. And
we did get one last question that just came through. Do you personally feel comfortable opening up the county?
No, I don't. I don't feel comfortable. You can tell by looking at my face. I really don't. I don't. I was surprised really. That the governor, of course, he's looking at his numbers. I don't know. We've not found those numbers. Carey and I have searched for them today, and I think Alex too. But I've not seen really the declining numbers. I know here in our county, in our Dade, Walker, Catoosa County, Tri-County, it's not. I don't feel good about it. But that's something we can't override the governor. We found that out at our commission meeting we had before. We had a couple of things. We had an ordinance that we were going to actually be a little bit more bearing than him, and we found out we cannot do that. So but that's why I'm asking you. You use common sense. I mean, if you saw the numbers going down, you would feel good about it. I just don't feel good about it. I'm not panicking because we know we're going to get through it, but just you need to think about it. Yeah. Oh, I'm sorry. Come on, Alex.
I've seen the questions too, and I echo Executive Rumley as the mayor. I don't think it's time, but that's why we're highly encouraging these social distance information. You're just as responsible if you do that to make sure that your people are safe as they come in. And us as individuals, we have that right to say yes or no if we're going into there. So it's tough. We've all got to worry. We worry about our families and ourselves and our communities. So please remember, if you do go out, I've also seen a thing about taking the time to do the cloth mask. Get them if you do go out, but please, these restrictions are here, and we still got some time to go on this to make sure, and we're all responsible for this, individuals, ourselves, our families, and these businesses that do come back open, and I believe all of them are going to follow these guidelines. And then if you have questions as a business, please give us a call as well. We will do our best to help you get those guidelines researched. They are on our website and CDC to follow that. So I just want to echo what Executive Rumley says, that I feel it is a little too soon.
We have a question for EMA Director Case. Will the county be providing any PPE to the larger employers in town to help businesses with the first stage of opening?
We haven't had anything for the public to be given through. We're on such a restrictive supplies that we're having to limit our out to public safety. I would encourage working with your suppliers to get that. We do have a place in right now for our health workers and law enforcement and that. So again, if you do have trouble, please give us a call. We will do our best. But they are mass producing this stuff. That was another thing as well. Besides getting the hospitals together, they're actually getting these supplies together as well. Again, if not the cloth mask, there's a CDC guideline on that. It's not as fine as an N95, but it does have its limits, but it also helps. It helps prevent that if you're into it. Again, the virus can be from touching a surface, by touching your face, coughing or sneezing out loud without covering yourself up. That's where some of it is. And then you also got to watch if you do sneeze into your shoulder or to your hands, you've got to clean that. It goes back to the cleanliness that's been talked about for all this time. You were teaching our children, cover your mouth when you sneeze or hold your thing. It's hard to do. It's things that we get in the habit of, but it's cleanliness. It's touching things and trying not to touch your face. So we've mentioned the common sense in this, and we get in habits of that. But please, if you do have some questions or some concerns about getting some of that equipment, we will do our best. Or, I mean, we're still on hold for several items just for that, and we've had to limit our information, our supplies out.
Thank you, Alex and Chad. And we got Evan. Evan, you got anything? Evan's been a regular here ever since we started, and we appreciate him contributing and helping us broadcast this thing over and over and over. And I appreciate my commissioners being behind us and doing a good job. I mean, even though, like I said, you don't see them here physically, they're here behind me. And Robert, he drifts in here and out, but he's been doing exactly what he's he's been keeping himself in and following, you know, the guidelines and as all of you need to do. But we'll be back here tomorrow at 3 o'clock, and just appreciate everyone, tuning in and be thinking of any questions, that you want to ask here with Carey while we're on the air. And if not, call my cell phone, 667-8999, 423 is area code, and we'll be glad to answer those or get answers for you. And we'll see you tomorrow at 3 o'clock. Thank you.